Jeannie Lauren Dowden for Conduit News, and today we have an exciting guest. Many of you will remember her, especially during the COVID era, Dr. Amy Beard. She's a functional medicine practitioner spending her time between Arkansas and Colorado. We're not going to hate you for that, Dr. Beard, but we're so glad to have you back on Conduit.
Yeah, it's been a while.
It has
Thanks for
been
having me back.
Yes, it has been a really long time, and I know that we've talked about it often, and I'm finally glad that we can connect and have you back on. There's so many medical freedom issues, new studies coming out, conversations that I think you've been sounding the alarm on for so many years, and to see it kind of now come to fruition where people are talking about it, I'm sure it has to be such an interesting time for you.
It's um it's good to see the conversations taking place. That's what I'm most excited about.
Yeah, there's so many things I want to talk to you about. I'm just gonna dive in. We're just gonna get
Sure.
to it. During President Trump's campaign, and then like shortly after, the Make America Healthy Again initiative really took off. Some really powerful, prominent voices got behind that and demanded medical freedom for Americans. Just first, tell us, what do you think about the MAHA agenda? How do you think the administration is doing so far?
Um, I'm all about medical freedom. I'm about freedom in general, all right? Any type of freedom.
Yeah,
The
exactly.
more
It's not hard.
the better the more ability people have to just make choices on how they best see fit for their lives, the better off, right? That's what this country was founded on, right? The ability to pursue those freedoms and definitely for health because I feel like we have just been pigeonholed into just this box and this way of doing things and actually being, we saw it during COVID, being forced to do things that we felt were not in our best interest and that we did not want to do. And so the MAHA movement has certainly brought medical freedoms to the forefront. And that's wonderful. The things that they are promoting, as far as I can tell, are I'm behind, you know,
Yeah,
um, and so far so good. It's not moving nearly as quickly as I would
yeah.
like to see it, and it never does. I mean, the it just seems like that's just the way government is, especially when there's a lot of bureaucracy involved. The wheels move very slowly, so that's been frustrating to see.
Yeah.
But I'm so glad to see that people are now speaking out again about the quality of the food, what's in our food, the vaccines, and not and removing mandates for those, um, and just think and talking more about how lifestyle is impacting our health.
Yeah.
These are great things that people are now talking about and maybe even being exposed to for the first time.
Yeah, I think so. I have family and friends who, and you and I talked about this on camera and off, and we experienced this, family and friends, you know, promoted and got the COVID shot, or didn't really think that there was any issue with the medical industrial complex that we talked about, or the foods that we eat. And slowly, I think that they're like coming to see, no, there actually is more to this now, or I wish I hadn't have done this, but now I can do this. And what are you hearing from clients, family, friends, kind of coming out of that fog of,
Yeah,
honestly, it was war during COVID, as far as just the
it
the mind
was.
games. Yeah. So, like, what
Mhm.
do you hear?
So a lot of people, as they should, no longer trust the authorities that have been placed on pedestals for so long. All the three-letter agencies that have had so much impact on health policy in this country have really ruined their reputations. And, fool me once, shame on you, fool me twice, shame on me. And so that has been good to see because, many like myself, we have been trying to tell people you don't want to trust these individuals,
Yeah.
just because of the close ties to the pharmaceutical industry. There's like this revolving door with people on pharmaceutical boards, then they're on, the FDA, CDC, NIH, and it's just like this, like I said, a revolving door of influence, and the, it's the trust is gone, and I'm glad to see that. Now,
Yeah.
we have to be careful about, when what takes the place,
Mm,
and we always want to stop. You just have to question everything. The time of just blindly taking people at their word, especially people in these positions, is over.
yeah. And I think a lot of people see that. There's been some really interesting announcements and studies coming out of the federal administration from Trump and from RFK. Most recently was, Trump, they did a press conference last week about Tylenol and possible links to autism. And he just simply gave a warning, to pregnant
Right?
women, don't take Tylenol. Here's what we recommend. And of course, you saw the left, like their heads just explode. And unfortunately, there was this, TikTok trend where pregnant women,
Oh,
it's so sad,
it
pregnant women were
is.
doing it, in defiance of President Trump. And I, correct me if I'm wrong, but I did see some accounts of these women being hospitalized. But for those who are not familiar or they felt like that information was too much to digest, what is he talking about? Break that down for us. And I went to your social media accounts recently, and you had shared an article again that you posted years ago, and you're like, I've been trying to sound the alarm on this
Yeah.
forever, but I'm glad that the conversation is happening. Tell us about that recent study and the link that the president was talking about.
Well, so Tylenol is the brand name for acetaminophen, okay? And acetaminophen, and most people know this by now, I'm not a fan of most pharmaceuticals. I don't care if they're sold over the counter or not. Many people think that they're just these benign substances because you don't have to have a prescription. That is so not the case. And
Mm,
acetaminophen is a great example of that. Acetaminophen, we've known for a long time, depletes the body's glutathione stores. Glutathione is a very important antioxidant. Many call it the master antioxidant. And it doesn't take very many doses of Tylenol to completely deplete your stores.
mm,
And this can lead you, can make you susceptible to harms from things that cause a lot of inflammation, reactive oxidation, um, and it can make you more susceptible to things like vaccines or the ingredients in certain in vaccines. And that and it's hard to say exactly what is causing autism. We know there's a correlation there because of um, kind of retroactive observational studies, right? Because
yeah,
there's never been a study of the effects of Tylenol on the fetus because those aren't allowed. It's not ethical, right? Because the fetus has no say. And
yeah.
so we no, nothing is ever done on pregnant women. So these have always been studies have been done, observational studies. And what Tylenol did was basically shove the responsibility onto the doctors.
Mm,
Is like, and they even said this, talk to your doctor about the use of Tylenol during pregnancy,
okay.
you know,
Yeah,
and then a lot of doctors just kind of went with it. When I was going through medical school, it was pharmaceuticals were pushed as like these
yeah,
wonderful things that rarely
yeah.
ever go wrong, and you give Tylenol or Motrin or something like that for a fever, and it's completely safe, and it's just not true.
Yeah. I can remember during one of our interviews forever ago, but you talked about med school versus how you practice now. And you said, we're just through med school, we're not taught to look at the root cause or, anything else. It's just strictly here are the symptoms, here's how you treat it, here's, the pill, etc. And that's what it sounds like what you're describing again. It's just that, Tylenol, acetaminophen, they were just able to push that to the doctors, but then those doctors are just trained to say, well, here's what you take. And so it's
Yes.
kind of very cyclical.
Yeah. That's it. And and if doctors do get a hold of some research about acetaminophen, it's highly unlikely that it's going to be one that is going to talk about the possible harms because they're looking at their journals, right? The ones that are
Yeah.
heavily influenced by the pharmaceutical industry. So you're just not going to get the information you need from these sources.
Yeah.
Um, and it's sad that there's still many doctors who just will not consider that what they have learned maybe just isn't so. Although
Yeah.
I do see a lot of doctors actually waking up to this as well because a lot of them are my patients.
Really?
Yes.
So does that change though then how they practice?
Well, I mean, when you're in the system, you can't really change too much about
Yeah.
how you practice. You can do a better job of informed consent, maybe talking to them more about lifestyle, things and things like that, but you're still kind of shoehorned into doing this or that,
Yeah.
check this box or
Yeah.
check that box. Um, so, but at least they're aware
Yeah.
now,
No, you're
and
right.
they
Yeah.
see it, and they're starting
Yeah.
to see through, look behind the curtain, right?
Yeah. I think the most difficult thing for me, and I want to talk about the immunization rates and how those are falling, as skepticism is rising, as we're talking about. The thing that's, most difficult for me is, once you know what you know, it's very difficult to go back. And, why are we injecting ourselves or our children with known neurotoxins that we know are not good for us? And um, like that's really difficult for me to reconcile that we know this and we're starting, at infancy, day one or day two with the Hep B shot. Like, how are we supposed to
Now that's
reconcile
day
all that?
one,
Is it day one?
um, well, I will say that they have put so much effort and money behind the vaccine propaganda. Just, I mean, this has been going on for decades,
Yeah,
right? Vaccines safe and effective, vaccines, and it's still very difficult for many to kind of consider that that's not
yeah,
true.
yeah,
It's worked, the propaganda has worked really, really well on a lot of people. Um, but you can't start ignoring what you see. And that's been the case with a lot of people who once were pro-vaccine, like myself, because I was taught that. And then you experience an adverse reaction and you see the effects of those on children, on
mhm,
adults, and you're like, hold up,
yeah,
that something else is going on. What is it? And that when I got injured by the flu vaccine, that's when it started. That's when I started doing my research and realized that I knew nothing
mhm,
about vaccines. I was taught nothing about them in medical school except the schedule. You knew that. You had to know the schedule because that was going
yeah,
to be on your board exams. And that's basically what we're taught. And we're not taught about the ingredients and what possible harms could come from that. And just
yeah,
the science that the vaccines are based on is bunk. When you
yeah.
start looking at their trials and the science behind it, it's laughable.
Yeah, I with the vaccine rates and how I mentioned, they're declining as more people, like you said, are waking up and they're at, these moms who have known, like we know when something's off or when something shouldn't, happen with our kids. And and I've thought about you so many times, like you probably just want to every day wake up and go, I told you so. I told you so. Because I know sometimes for me, when COVID comes up, I have to pray about it and bite my tongue and not, go there and just be thankful that people are waking up. But, you know, do you see any concern with, this vaccine hesitancy or that, the rate is declining at all?
I love it.
Do you have any concerns about how maybe, government or the medical industry may try to come in and course correct it, and what would that look like?
Well, they already are, right? The Academy of Pediatrics is pushing back against it and wanting the COVID vaccine to stay in place for infants and children, which is stupid. There's absolutely no basis for that or at all. Okay. And then,
Yeah,
of course, they want to remove the vaccine exemptions. Religious and medical, they don't think those should be, or I think the religious, I think those were the ones that they were
yeah,
going after.
yeah, that's what I thought.
So yeah, there's absolutely going to be blowback because this is a huge money making machine, not just the vaccines themselves, but the issues that they cause. You are
Yeah,
creating customers for
yeah.
life with these
Well,
things.
yeah, and you hear it's wonderful and good to hear our national leaders say, especially like RK, where he's saying, like you said, they're creating customers. They want you on that wheel to keep you sick. They don't make money if you're healthy and you don't need, yearly wellness check-ins to get your medication. That's not how they make money. When we're looking at states, and you and I talked about this offline, Florida, and there's lots of different voices happening right now in Florida. Like I think Byron, what's his last name? Nelson. That might be. I'm not sure, but people will correct me, after we post
Yeah.
this. But he said, well, I'm not sure about eliminating, vaccine mandates, et cetera, et cetera. Then you have DeSantis and even his wife, Casey DeSantis, saying, nope, we're not going to mandate vaccines. We're not going to, force you and tell you what to put in your body. And then they're even taking a step further and, on the state level, studying ivermectin, the benefits of that, possibly looking at additional cancer research, which talk about a money-making machine.
Hmm.
To me, Florida looks like they are leading the way in medical and health freedom. Um, I don't even want to contrast. Well, we will. We'll contrast that to Arkansas in a second. But what do you think? What do you think?
Um, as far as Florida goes, I'm loving it. Anytime that people are free to make choices on how they feel they should proceed with their health is good. I don't care
Yeah,
what it is. And I don't care if they're doing something I think is harmful. If that's what they want to do, then they should have the freedom to do it.
yeah,
That's really what it comes down to is everybody having the ability to make the choice for what they feel is right for themselves and their
yeah.
families.
In Arkansas, I don't know if you were paying attention that much. You may have been in Colorado, which is fine, but during the legislative session
We
earlier
still
this
have
year,
the internet here.
I mean,
I'm not in a cabin at,
no, you're
10,000
so
feet.
far away. It makes us sad. No, you're right. Okay, well, I don't know if you might have been tracking it or not. If I were you, I don't know if I would have, to be completely honest.
I
But
do try to stay off of it.
I don't blame you. But there were a few bills out there that some of our legislators did try to run that related to medical and health freedom. There weren't that many.
Mhm.
We advocated and would have loved to have seen an overhaul. Again, not to mention Florida, but they had kind of like a three-pronged approach to medical and health freedom that they passed back in 2023, and it was fantastic. No one really wanted to take up that charge here, but so there were just a few here and there. One of those was from Senator Penzo, simply removing a mandate. That's it, removing a mandate, putting fluoride in our drinking water. And
Mhm.
then Senator Alan Clark, which had the
Mhm.
ivermectin bill, and I can't remember who ran that on the House side. And then as far as other medical and health issues. People can correct me too. Those were kind of the big
The raw
ones.
milk one, right?
The raw milk,
Remember?
that was very early on. That's right, the
Yep.
raw milk one. Just my 2 cents. I think it was embarrassing and shameful that Arkansas could not do an easy lift like repealing the fluoride mandate. And I actually thought it was a little rich that after we got done with session, all of these other states, Florida and others, removed
Mhm.
fluoride from the water, and then RFK and Trump made that one of their initiatives as well. And I was like, huh, I thought you guys were so red and Republican, and you call yourselves MAGA. You couldn't even get a toxin out of our drinking water, a mandate repealed. Um, when you look at the state of Arkansas, even ivermectin was not easy for them to get over the finish line there for a while. What do you see in Arkansas? Your opinion?
Well, I think you just kind of said it. There's people who claim to be Republicans, which were supposed to be for freedom, right? Personal choice, but the actions say otherwise. So I've got to kind of question what you call yourself and why you do that, if that's the case. Perhaps you're not. And I don't, I don't get it, but I'm not up at the Capitol. I'm not involved in those fights. I'm not really seeing what's going on behind the scenes. But I would think I don't understand um the pushback from quote Republicans on these
Yeah.
matters. It should seem like that would be an easy thing to get behind.
Yeah, I think so too. What would you recommend, or what would be a policy initiative that you would like to see Arkansas take on, or even on the federal level, Congress, or RFK Trump take on? What type of recommendation regarding medical and health freedom would you love to see come next?
Um, wow, that is a tough one. I mean, the we need to the vaccine hill is the hill I will die on. So to see our state eliminate mandates would be wonderful to see.
Yeah.
Because from my standpoint and from what I see in my practice clinically, that is where a lot of damage is occurring, is
Mm,
that. Um, Something that has been near and dear to my heart too is the food that is being served to children
mm,
in the public schools.
yeah.
If you want to improve behavior, improve test scores, stop feeding them poison.
Yeah.
It's not even it's food like substance. It's not even food.
Yeah. It's bioengineered.
It's just trash. It's sugar, simple carbs,
Yeah.
glyphosate, preservatives, food dyes. It's I mean that and the hospital food is about on the same level.
I've always thought that was so ironic.
Yeah. But that it's you know when you're 70 and 80, that's one thing, but there's only so much you can do at that point. There's still things you can do, right? And I
Yeah.
see it because
Yeah.
we have people in
Yeah.
that age group who come to me and we are still able to help them a lot.
Yeah.
But it's the kids, it's the ones that are, 5, middle school. That is where you can make such a difference in the trajectory of their life by addressing these foundations of health. So if you can get them when they're young, not inject them with poisons, stop feeding them poisons. Man, you talk about just you're going to help the trajectory of their life
Yeah, absolutely.
greatly.
Yeah. What would you say to, I've had these conversations with friends. People have texted me asking me this, I think because they know where I stand, and so they're looking for help. So I'm going to ask you, um, what do you say to moms and parents who they uh, are more aware, like what we're talking about the health of their child, and they are taking more responsibility regarding the vaccines and the vaccine schedules and what they think is best, and they're going to their pediatrician and numerous clinics around here I've heard of. And if they don't follow the vaccine schedule and these kids aren't vaxxed, then they can't be seen at these clinics. And you and I have talked about the medical industrial complex. There's just conglomerates of these
Mhm.
clinics here, and I do think that there are more places popping up to provide that kind of what we've talked about, also that
Yeah.
parallel care, but I don't know if it's enough. So what do you say to moms who are like, you know what, I don't want to follow this vaccine schedule and I believe this is what's best, but my child can't be seen if I don't follow this protocol. What do you say?
Well, you, there are still a lot of family doctors out there who won't kick you out of their practice. We were taught how to take care of children and
Mhm.
infants. The family doctor was the doctor of the
You're
day.
right.
Before all
Yeah.
the specialization occurred, they were the doctor. They were even
Yeah.
performing surgeries. My family doctor performed surgeries in addition to being the family doctor. So they know how to take care of infants and children, teenagers. And so I would go seek out one of those because you're less likely to be put into this situation of get a vaccine or go elsewhere. The,
Yeah.
the, the peds clinics are notorious for this. So, and that's what I tell my patients, go find yourself a family doctor. A lot of people just choose to use me as a family doctor when they have problems. If you're
Yeah.
not having any problems, why are you going to the doctor? Because
I
trust
know.
me, they're going to find something wrong with you
I
that's
know.
going to require a pill or something. Not that they can't
Something.
catch things. Okay, I don't want to say that,
I know.
they can catch some things sometimes too, right? But this thing about just you got to go in for your wellness visit. You got to go in for this when you're feeling completely well. I don't know. I don't think that's probably a good thing to do in that system.
Yeah. No, I agree. And I think, for those who have insurance, it's they get hounded on those wellness checkups, and because the office and the insurance provider, they've got to check that box,
Right. Yeah.
even if you're totally healthy. Um, During COVID, I pulled this up. We saw about a week ago, I guess YouTube and other platforms have come out and said that, oh, you know what, you guys, we're so sorry. We'll tell you this now that it's over and it's water under the bridge, and we hope that you aren't mad at us now. But remember during COVID, we actually did, throttle information and take things down and punish you and all of those types of things. And I was like, I know some of our YouTube videos got taken down, and they were all of your interviews. And I found a screenshot in our text thread, and you're gonna love this, and I want your initial reaction. So, on our YouTube channel, on Conduit News, during COVID, it was on June 3rd, 2022, we got the first community guidelines strike, and the content was removed due to a violation of our community guidelines. Um, and it was your interview, and I can't see the full title, but it was labeled medical misinformation. Dr. Amy Beard, if you can't challenge or confront it, it's not, and I can't see what the rest of it said, but I have an idea, it's not science, it's not something along those lines, because back then, remember how they would say the science is settled. The science is settled.
Science is never settled.
And that's what this video was. Is it settled? And that I can remember like it was yesterday. That's what you were saying. You were like, science is never settled. We are called as doctors to question and reevaluate and look at it. YouTube took that down.
Oh, I'm still being throttled.
You are.
Yes,
On
and it's
what
okay.
platforms?
Um, Facebook big time. I just we don't grow at all. People have told me like I never see your posts anymore, and I don't whatever. I'll let God work that out.
Yeah, yeah. Well, I mean, think of the platform that you do have and the lives that you have changed, Dr. Beard.
Yeah.
But I know that, and another one. let's see, there was another, that was strike two. There was another video that was taken down. And then, speaking of Facebook, um, your content was removed due to a violation of our community guidelines. Your channel now has two strikes. We weren't able to upload, post, or live stream. Um, it was such a wild time.
It was wild, frustrating, but I knew that eventually I would be vindicated. And look,
Yeah,
you know,
here you are. The tr when you have the
the
truth on
truth
your
is going to
side,
come out. You just
that's
have to
right.
kind of be patient, endure the storm, and
Yeah,
know that, yeah, the truth is going to come out eventually, and you know,
yeah.
and that's
With
exactly what happened.
Yeah, and we're so thankful for that. With the Make America Healthy Again initiative, people are talking more about not, just finding a pill to cure things and not masking over illnesses. And then because once you do that, you take a pill for this and you might have high blood pressure. So then now you have to take a blood pressure medicine and then you have the, and people are talking more about getting to the root cause of the issue and, being wholly healthy. And
Mhm.
that's exactly what you do at your practice with functional medicine. And talk to us about that. What are have you seen an uptick in, people coming to you and having new
Yes.
patients? And, um, what do you want them to know about, just that holistic approach?
So, I've done it both ways, right? I've done it the conventional medicine way, the pill for an ill, check the box, and then I've done it this way. There's no comparison. It's like apples and oranges. The functional medicine approach to uncovering and addressing the root cause mediators of why you're having the symptoms you're having works far, far better.
Yeah,
But it's not an overnight thing. And that's something else that has to change because people have been so programmed to take a pill, the symptom goes away, just like that.
yeah,
That's not going to be the case with this approach, although things can happen quickly, and they do for a lot of
mhm,
patients. But you didn't get there overnight, and your symptoms aren't going to be reversed in a week.
yeah,
But I can promise you that they will if you stick just patience. If you give the body what it needs, remove what it doesn't, it's it will heal itself. That's how it was designed to heal. And you can do it without pharmaceuticals and surgeries and procedures. Not that sometimes surgeries aren't necessary. I get that.
right.
I'm not wanting to throw away the entire system. I'm glad we have things like emergency rooms and trauma surgeons and other surgeons who can perform surgeries when they truly are necessary.
Yeah,
But a lot of it just isn't because these doctors don't know anything about root causes. We weren't taught that.
yeah,
And that's what you need to know about your doctor is they may be very nice, have a wonderful bedside manner, and they truly want what's best for you. They
hmm,
simply don't have the tools to help you because they weren't taught those tools. And they work within a system that doesn't even give them the time to implement, using the
yeah,
tools if they wanted to. But
yeah,
we're getting a lot more patients who are hearing the word functional medicine. They're doing a little bit of research. They're liking what they see because after you've seen so many specialists and taken so many pills and you're still not better, why do you keep doing the same thing over and over and expecting different results? Pharmaceuticals have never cured anything.
yeah. Um, you and I have talked about this, and my medical history. I suffered with migraines, debilitating migraines for decades. They started first with grand mal seizures and then migraines. And I can attest to exactly what you're talking about. And all of my neurologists were so nice. Like, I want to preface that and say, always genuinely had my best interest at heart. But it got to a point like 12 years in where nothing was getting better. In fact, it got worse. And then, we were just compounding prescription on top of prescription. We'll do this injection and then this monthly injection and then this daily preventative. And at the onset, take this. I mean, it was just bananas. And a few years ago, not even that long ago, I was like, I'm done. I'm done.
Mhm.
I'm sick of it. And I think we talked about it. I started tapering myself off and no daily preventative, no injections, none of that. And I feel better now. It was a little difficult getting off of it,
Mhm.
but I feel better and have fewer migraines now off of everything than I ever did during those 2+ decades of intense medical treatment. And I'm not saying that that's the best course of action for everyone, but I do feel like what you're talking about is what happened with me, and my body slowly over time healed itself. That's not to say I don't have a migraine every now and then. When I do, I go get
Right.
therapeutics or something like that. But it's been a game changer. Unplugging
Yeah.
from that.
And a lot of medications are very deceptive. They'll actually cause the problem that you're using them to treat.
Mm-hmm.
And weaning off a lot of them can take a long time and it can be difficult. It's just not fun to wean
Yeah,
off a lot of these, but it's
yeah.
absolutely necessary for healing to take place, or you're just going to keep having the same problem. Here's another thing I want to bring up before our time is up is I would like to see functional medicine covered by insurance if we're
Mm,
still going to play this game. Okay. I know people are talking about parallel systems. There would be a lot more physicians that would entertain the idea of becoming functional medicine practitioners and learning what that looks like and how to treat people from this holistic perspective and root cause place if they could make a living.
mm,
This is not an easy thing. And a lot
yeah,
of people who go into functional medicine don't make it. It's not easy. It's hard. You make a lot less money than you would if you were to work in the insurance market. That's
yeah,
just something I've accepted, and I'm okay with that. I don't need to be a gazillionaire. Um, and God has provided. But a lot of them are interested in this, but they're like, I've got student loans, I've got kids in
yeah,
college, they've got all this medical school debt, and you look at how long it can take to build a practice and all of that, and
tempting.
it's not possible for some people.
Yeah,
I was able to do it because I have a husband that was subsidizing it. He believed in it. And he was helping me.
also
And I was
great.
also working three jobs at one time, and I didn't have
Yeah,
children to put through college and
yeah,
living like a pauper, basically, to get to where I am.
yeah. Would th that would have to be something done on, I mean, you're talking about massive insurance companies. How would they even, is there anyone having that conversation?
There are some who accept insurance for functional medicine visits. It's
Okay.
typically your nurse practitioners who don't have the salary requirements that physicians have who have been in school for a long time and have
Yeah.
accumulated a lot of debt. But they're all, we tried that and it wasn't keeping the doors open.
Mm-hmm.
It was we tried it and
Yeah.
it just did not work. And it was very limiting too. They don't want to cover labs that you order because it doesn't fit the box for that diagnosis. They're very two different very schools of thought
Yeah.
on
Yeah.
how disease occurs and how you go about
That
reversing
makes
it.
sense. Yeah, that makes sense. I have so many questions for you. We could do this, you and I both know we could do this all day long, but I'm not because I want you to come back soon. So, for people who want to find you and your practice, what should they do?
Yeah, so you can go to the website. It's amybeardmd.com. And if you are considering becoming a patient, everybody has to talk to my husband, Paul. It's a free exploratory call. Okay, and you can get on the schedule. He does these on Tuesdays and Thursdays
Okay.
because we don't accept everybody as a patient. You've kind of got you need to understand what you're getting yourself into because we don't want to waste your time and money, and we don't want you wasting our time either.
Yeah.
But and then you could just run your thoughts. You guys can have a conversation and see if we are the best fit for what you are looking for. But I will say that this approach works for anybody with any condition, no matter what.
Yeah. And for moms and parents, you also have a ton of resources for kids too. And I don't, we can
We
talk
see
about
a
this,
lot
but
of kids.
yeah, and like heavy metal or metal detox programs. I don't know if you do that or not. Do you?
We do. I have worked with a lot of autistic children to
Okay.
help them reverse the damage of what vaccines cause, what we know vaccines cause, you know.
Yeah.
Um, but I love working with kids because they're so resilient and they bounce back quickly. You know,
Yeah.
they're very different than the 65, 70-year-old woman who has half her organs removed and
Oh
on 10
gosh.
pharmaceuticals. Those patients take more
Yeah.
time,
That's
as you can
hard.
imagine. But I still like those because we still have success stories.
Yeah.
You know?
Yeah.
And then, so we see kids, we see everybody and anybody in between, teenagers, 30-year-olds, whatever. We see
Yeah.
them all.
Well, I encourage all of our viewers to go to your website, amybeardmd.com, and also find you on Facebook, Dr. Amy
Facebook,
Beard.
Instagram, we have a Pinterest page. We also have a membership program. There's all kinds of things that we are exploring. And
Yeah.
it's all because I want this to be accessible.
Yeah. Well, that's what I was going to say. You put out, people really need to go find you on social media. You are constantly putting out information out there to inform and educate people for their good. And so I love everything that you do. We're so thankful for you and your practice and how you've, just been speaking truth into all of this for so long, so many years. And so we thank you, Dr. Beard.
Thanks for having me. This is where God wants me, and I'm going to keep doing
Yeah.
God's work.
Yeah. Well, we're so
I've
glad.
gone through a lot of my own health challenges,
I know you
and
have.
looking back over it, I know why.
Yeah. Yeah.
Yeah,
Well, we're thankful for that and thankful for you. And I hope that you come back on again really soon.
I will absolutely be back if you'll have me back.
I will. Thank you.